importantly, is that we're moving away from being ad hoc to being very strategic, systematic, and being grounded within a specific communication theory. So, what theory informs what we do in UNICEF and in a lot of other organizations? Now you realize that there's thousands of communication theories, but each of these theories explains the reason why people behave the way they do. Now, what we use within UNICEF is called the socio-ecological model. This is basically a framework that explains the interaction between, individuals and the environment within which they live. Because you do realize that the way people behave is influenced by a number of things. So if we are doing a communication program and our focus is on the individual, then we do miss the point. So the socio-ecological model basically has 4 levels. The first level, which is the most inner version, is the individual level. The second is the community. After the community is the organization, and then the society. Now you realize that whatever we do as an individual is influenced by the community within which we live, by the society in which we live, and by the bigger, environment, say at the policy or societal level. And therefore, we need to be able to address these. In terms of C4D, we need to be able to prioritize our interventions across each of these different levels. Now, when you look at each of the levels within the socio-ecological model, there's different communication approaches that you can use in order to deal with those. Now, one of the commonest, which has been used over a period of time, has been behavior change communication. But there's been quite a bit of shift from that. Again, because if you say behavior change communication, it means you're focusing on me as an individual, and yet there's so many things that influence the way I do behave. The woman's decision to breastfeed is a result of so many factors. The husband support, the mother-in-law, the availability of breastfeeding facilities, the government policy on, advertising of breast milk. And we begin to see this within cholera as well. Because we know that, an individual's decision, for example, to wash hands with soap is dependent on the access to both the water to use for washing, but also the soap. So what happens is that, at each of these levels, we use a different C4D approach. Behavior change communication and social change to focus at the individual and community level. Social mobilization to focus at the organizational level, and then advocacy for the wider, for the wider context or environment within which we work. Now you will realize that C4D uses a mix of channels in order to be effective. It requires capacity strengthening. I prefer to use the word capacity strengthening rather than capacity building. But we also realize that in order for it to be effective, it's got to, you've got to ensure that whichever approach you're using runs across the different levels. I already talked about this, is that individuals act in a socio-economic and cultural context, and therefore, as long as we don't understand that context within that individual we will not be able to achieve what it is that we want to. We know that access, for example, that access to clean water and soap impacts on any hand washing campaign. So what do we see as the role for C4D in cholera prevention and response? I mean, there's different things that we can look at. Promotion of individual and household, practices, at being able to address the social norms and barriers for uptake of services, the exercise that Jackie just took us through. You can also use it for advocacy, for improved access to health and wash, services or infrastructure. With regards to the response, issues around information on the signs and symptoms, treatment information, availability of services, being able to address rumors and misconceptions, community surveillance, and adherence to treatment. Now, what is the challenge that we see from a C4D perspective? The biggest challenge in terms of C4D for cholera prevention is that cholera is basically seen as an emergency. I almost don't know any place where I've heard or seen any communication activity related to cholera if there isn't a cholera outbreak. Now we know that there is a problem with that. Why? Because fear is very short term. So, people can, we can raise the fear within that short time when there's an outbreak, but this basically fades with time. And as soon as the outbreak is gone, people go back to the previous behaviors that, that they were practicing before. And yet we know that long-term C4D involves engaging and motivating, behavior change. We need to be able to engage with people. We need to be able to, to raise issues of disgust. One of the things that we do realize is that we tend to be a bit rosy about cholera in a lot of the communication. Now, there's nothing rosy about cholera because cholera is got from eating feces. Eating or drinking feces, that's it. There is no other way you get cholera apart from eating or drinking feces. But that's a message that's not been clear across all our communications. I mean, that's it. We can try to be rosy about it, but that's exactly what it is.